The Democratic Alliance has written to the Speaker of the National Assembly, Thandi Modise, requesting an urgent debate of national importance regarding South Africa's COVID-19 vaccination plan. Now, the party's second request for a vaccine debate in Parliament follows Health Minister Siviwe Gwarube's announcement of a vaccine rollout strategy yesterday. For more on this, I'm joined by the DA's spokesperson, Siviwe Gwarube. Siviwe, thank you so much for your time this afternoon. Now, not only did you write to the Speaker for the second time asking for this debate, but you've also, in your capacity as a DA Shadow Minister for Health, applied or submitted a Promotion of Access to Information Act, the PAIA application. Perhaps before we speak about that application, talk to us about this latest letter and request to the Speaker. What are you hoping to achieve?
Thank you, Unati. It's very important, Unati, to realize what the role of Parliament is, particularly when it comes to managing pandemics of this nature. Often people ask, what will a debate achieve? Why must we be calling Parliament to come back and debate matters when we should just simply be procuring vaccines and rolling them out? And while the two things can be true at the same time, the reality is that Parliament has a crucial role to play. It had a crucial role to play right at the beginning of this pandemic crisis, and now it has an important role to play in holding government to account. The reality, if we don't exercise that role, then it means that executive power is exercised without any form of oversight, and we are not essentially doing what is constitutionally mandated to us, and also what the South African public trusted us with. They trusted us and sent us to the Houses of Parliament in order to hold government to account, to ask the critical questions, to ask for the timelines, and to hold them against those timelines. And so we can't simply say we will wait until Parliament resumes in February before Parliament can get to work. The world didn't go on leave. Parliamentarians shouldn't be going on leave, and we should be seized with this matter. And that's why it's our view that an urgent debate is not just a nice to have. It's an important oversight mechanism, because at that debate, that's when you will have government giving critical timelines, giving critical information that we need, and not just PowerPoint presentations. Secondly, the call for an ad hoc committee has something that the DA has called right at the beginning of this crisis. Again, it's very much a very strict oversight mechanism for Parliament to be able to hold government to account and to be able to exercise oversight on some of these government plans, so that we can be at each and every step involved in ensuring that government sticks to its promises.
Now, in your capacity as the Shadow Minister for Health, talk to us about the PAIA application that you've submitted. What are the key points that it touches on?
So so a PAIA application is actually a very useful tool to be able to obtain specific information. And so our view is that while the briefing by the minister yesterday was welcome, it was essentially information that we should have had access to about 2 months ago. It wasn't that the level of detail that we received is not the level of detail we should be receiving at this critical juncture of the negotiations that are happening around the country. And so our view is simple, that if the South African government has a clear plan that is detailed on the rollout of this vaccine, then we need to be able to see it. It's not simply good enough for the minister to give a briefing to the nation. We need to be able to see a clear codified plan that essentially states for us the following. One, what are the procurement mechanisms? We are concerned about the centralized procurement that was simply mentioned in the briefing yesterday. We want to understand what that will be about, particularly because if we are aiming to vaccinate over 67% of South Africans, that is a huge undertaking. And how wise is it then to centralize procurement only with government? There's issues around logistics, around delivery, transportation, and essentially rollout of the actual vaccine. And all of these things are details which continue to be missing in the South African plan. And we're giving the opportunity to the minister to say, you've got an opportunity now. Legally, you are obliged to give us this information because it is of public importance. Provide the South African public with the assurance that, in fact, this is not just an aspiration, but it is a plan that you have, and you'll be able to follow through with it.
You know, you are right and correct when you say South Africans are concerned about just some of the missing puzzles and pieces of the puzzle as it relates to the plan. But what has the Speaker said to you? Is she entertaining your requests at all?
The Speaker initially, when the Chief Whip of the Democratic Alliance wrote to her requesting for an urgent debate, had stated that, look, because we didn't have the details yet from government on its actual vaccine rollout plan, let's rather wait for that to be presented. And then on the basis of that, look at whether or not an urgent debate is still much required. And so looking at the presentation yesterday, which is now where the minister and his team essentially presented what they have, and our view is that this is what they've been working on for the past 2 to 3 months. We are way behind schedule. Countries of the same socioeconomic status like Kenya, Morocco, Colombia, are all countries that have already started rolling out a vaccine, and we're not anywhere near that. And so really now we are saying to the Speaker to reconsider that on the basis that the information that we were given yesterday is not adequate and that further details are needed.
Now, one of the things that you've mentioned and you've touched on was that one procurement approach. Now, we know that Dr. Pillay, who also sits in that ministerial advisory committee, said that the approach now in terms of disseminating of this vaccine will be that one a procurement approach. But we know that earlier in terms of South Africa's handling of COVID-19, that procurement approach is questionable, and it is why we are sitting with this PPE corruption scandal at the moment as a country. What confidence do you have in the Ministerial Advisory Committee?
Look, we're concerned about the central procurement on two levels. The one is more of a practical one. Firstly, if you have this audacious task of trying to vaccinate over 67% of South Africans, that is over 40 million people. The South African capacity, the health system capacity in the country stands currently at us being able to vaccinate 1 million children, which is an inoculation program. So we've never really undertaken something of this magnitude. So where's the wisdom in government saying that it is only them that can procure and it is only them that can essentially roll out this vaccine? So the one concern is on a practical level. And then the other concern is, as you say, the issue around mismanagement and corruption. And so this is why we are imploring Parliament to say, this is where you step in. This is what South Africans require us to do. We need to ask the critical questions. What is this procurement process looking like? And also, what are some of these NDAs that have been signed? The minister said yesterday that they can't divulge the pricing that some of the manufacturers of the vaccine are giving them simply because they've signed NDAs. These are the questions that Parliament must be asking, because it's essentially, if you're failing to do that, then what is really the role of a legislative house if it is not to hold government to account?
You mentioned that you want the National Assembly to urgently establish this ad hoc committee to oversee the rollout of the country's vaccinations. Give us some of your key or your top level focus areas that you want this ad hoc committee to oversee.
Ultimately, an ad hoc committee will be comprised of a multi-party body. And so it is not just simply something that the Democratic Alliance wants to lead, it is something that Parliament must lead. And it must be representative of the parties in Parliament, because we are of the view that South Africans have voted people in who are there to represent them and their interests. And so Parliament must then convene such a body. Secondly, you are able to elect a chair, you are able to summon witnesses, you are able, it is far more serious than simply allowing a minister to, on his whim, because currently what's happening is that the minister can either receive pressure from the public, and then he may decide to give a briefing to the nation. But that's quite frankly not good enough in a pandemic situation. He needs to be obligated to report to Parliament periodically and also consistently with timelines that have been set by the members of Parliament, and for him to report where exactly his department is. So it's not just a nice to have. And we need to move away from this notion as South Africans that when government gives us information, we are somehow grateful. That's what they're meant to do. That's their job. And in fact, it is the members of Parliament who need to push for greater accountability and greater transparency. And so such an ad hoc committee will be able to formalize the kind of information that we need, and we'll be able to summon the kind of information that we need instead of this piecemeal fashion that we have now.
Now, very quickly, Siviwe, we've run out of time, but very quickly, if you had to look at the 67% of people in South Africa that have to be vaccinated by the end of December, say, how realistic is it to vaccinate, say, 100,000 people per day?
We've never done something like this, Unati, before. As I said, our only capacity and experience in this is vaccinating 1 million people a year. And so if government cannot give us a plan that's codified, that's been worked on, that has been consulted on, that has been signed upon on, that is budgeted and resourced across all provinces, then that's a pipe dream.
All right, Siviwe Gwarube, thank you so much for your time. That is Siviwe Gwarube from the DA, Shadow Minister for Health.